All right, good morning, everyone. This is Steve Kalina. I'm the president and CEO of the Minnesota Precision Manufacturing Association, partnered in this webinar with series with Tri-State Manufacturing Association and Central Minnesota Manufacturing Association, as well as several others. We hope that you, your family, and your businesses are all doing as well as possible in these tough times, and our thoughts and prayers go out to all of you. We really appreciate your taking the time on your very busy schedules to join us. We know there are many webinars that are being presented daily, and we want to provide the best content that was specifically geared to help answer questions of manufacturers and provide manufacturing solutions. Some daily updates. So right now, I've been talking to a lot of manufacturers lately. I've been fielding phone calls, emails, texts daily, and having lots of conversations. Definitely the top three issues that we've been hearing are the SBA loan side. Of course, many of you know the SBA opened up their economic injury disaster loans this weekend to small businesses in Minnesota for loans up to $2 million that are to be used on existing expenses such as payroll, accounts payable, and more. So lots of manufacturers are looking into that. They did recommend that anyone who has any possibility of applying for that loan or any possible interest in the loan, apply for it now. It's going to be kind of on a first come, first served basis on evaluating it. They don't expect to run out of funds, but they are suggesting everyone to apply as soon as possible. And then, as most of you know, the governor has not yet declared a shelter in place or shutdown order. Yeah, Tom, if you can advance to the next slide, please. For right now, probably the top topic in the last 24 hours has been the essential business status. So even though we haven't gotten a shutdown order yet, we don't expect it today, but we do expect it in the next 24 to 48 hours. There's not currently a process for requesting the essential business status. Lots of questions are floating around that. The governor is working on that. They should have a process in place, and we hope that it's going to be as smooth and quick as possible. But when that order is given, we want to make sure that as much due diligence has been done as possible, making sure that you've got letters from your customer base that are essential, and that you've read the CISA standards and that you understand what you do or don't meet as far as the essential business status. So I'd encourage you all to spend some time looking through that. Lastly, I think probably the third most important topic is the concerns over the labor side, which of course we're covering today. But how to handle ill or potentially ill employees, how to handle the people that might have been exposed to those ill employees, and then how to figure out creative solutions to minimize our risk and keep operations going. So again, we'll be covering those things today. Tom, if you can go to the next slide, please. Just some quick legislative updates. Of course, we know that there is no shelter in place as of yet, and we don't expect that today. Legislators are working on a variety of COVID-19 related bills, issues related to child care providers, additional flexibility to healthcare industries like long-term care, and ensuring that hourly school workers continue to be paid, and placing a temporary moratorium on evictions and foreclosures. The latest executive orders from Walz were related to non-hospital entities that have PPE, so personal protective equipment, and making sure that every business does an inventory by the 25th, which is tomorrow. So pay attention to that, and everyone should be looking at their personal protective equipment and doing that inventory. The Minnesota state income tax filing deadline has been extended to July 15th. Minnesota businesses that have been negatively impacted by COVID-19 are now eligible to apply for the SBA loans, as I mentioned a minute ago. And then DEED has created a partially forgivable loan program to assist businesses who have been required to close because of previous executive orders. So I'd encourage you to look into a few of those resources. And Tom, next slide. And just a few other things to be aware of. Right now, Medical Alley created a mechanism on their website for basically posting information if you've got available resources or if you need resources. Primarily, they're focusing on the medical industry, but realistically, it's anything that you think you could present or provide to the essential industries, or if you are an essential industry, if you need some resources. Also, Minnesota Chambers Grow Minnesota initiative and their supplier match program is looking at ways to do that as well. So those are key things to be able to make your business an essential business right now. And then I would also recommend reach out to your OEM customers, make sure they've produced a letter to you explaining that you're a key part of their supply chain and critical to their essential operations. And then let's see here, I already mentioned the PPE inventory, so make sure you're watching for that. And then also the SBA loans, I mentioned that as well already. So those are some key things to be working on right now and looking into. So, all right, well, if you can move to the next slide, Tom. Today we're going to be focused on labor challenges and shortage and solutions. Eckberg Lammers is a law firm that's a member of MPMA, and they've obviously been doing a lot of work lately to help companies figure out some of the challenges that we're facing. They're going to focus on some of the legalities of dealing with ill employees and new regulations on FMLA. And then after that, Division 1 is going to give us some information on some specific solutions manufacturers have implemented. So I'm going to hand the controls over here to Chris and Chris Nelson from Eckberg Lammers, and thank you very much, Chris.
Thank you, Steve. And as Steve said, my name is Chris Nelson. I'm an attorney with Eckberg Lammers. We've been working on this as a firm, specifically Tom Lunan, Lyda Bannock, Kevin Sandstrom, and I have been looking at these new laws and forthcoming regulations to try and determine what effects that the Families First Coronavirus Response Act will have on employers and how to best respond to it. Now, there's really 3 provisions in that law that will have a substantial effect on your relationship with your employees. We'll go through those today. And next slide, Tom. So first, the biggest difference between the new law and FMLA as it previously existed is the expansion to the number of employers it applies to. So under typical FMLA, if you had under 50 employees, basically you were exempt and that law didn't apply to you. However, with the Families First Coronavirus Response Act, it applies to employers who employ 500 or under people. So the number of employers to whom these protections apply to has been greatly expanded. In addition, the number of employees who the protections apply to has also been greatly expanded. You know, you used to have to work 1,250 hours in the preceding 12 months in order to be eligible for the FMLA protections. Now there's a 30-day look-back period. If the person's been employed by the employer for 30 days, these coronavirus additional protections will apply. Finally, on the slide, you'll see that the law takes effect on April 2nd. That's the latest day it can take effect. The effective date of these provisions is up to April 2nd, and we're expecting some guidance tomorrow from the Department of Labor, which should clarify perhaps the effective date and some additional regulations to know how these provisions will affect employers. Next slide, please. So the first provision, Division C in the new law, expands protections, and this is really the child care protections. This is under the FMLA. It's an emergency provision under the Family and Medical Leave Act that says if you're unable to work or telework because you're at home caring for a child who doesn't have child care or the school's closed, so this affects tons of employees at this point, considering that the state has closed schools and they're going to be closed for the foreseeable future, that they're entitled to leave under FMLA, and that's 12 weeks of leave for the provision at the time this person's unable to work for that reason. And the major difference is, whereas typical FMLA leave is unpaid, this leave would be paid. Now, the leave is capped in how it's paid after 10 days for which the person isn't eligible for paid leave. They do have the option during that unpaid period of using vacation, sick time, PTO, whatever they have in banks with you, the employer, beforehand. So they have that option for the initial 10 days. After that, for the remaining 10 weeks of leave, they would be paid at a 2/3 rate, capped at $200 a day. And this is paid by the employer. Now, there'll be a reimbursement provision through Social Security taxes that we'll address in a little bit, but the initial upfront cost of this paid leave will be paid by the employers, subject to reimbursement. So that's the expansion under the Family and Medical Leave Act. The Act still applies in its standard terms, for all the reasons that it would apply anyway, but these are the expanded provisions related to the coronavirus. Next slide. There is, in effect, a hardship exemption. Again, we're waiting for some guidance from the Department of Labor on who might qualify for the hardship exemption, but it's looking like if you have fewer than 50 employees, you have to show the imposition of such requirements would jeopardize the viability of your business. Again, there might be some regulations and some guidance coming from the Department of Labor, but we can expect that would be a substantial showing based on the fact that the law encompasses these reimbursement provisions. Next slide, please. This provision E from the bill, the emergency paid sick leave, is a substantial change. Every employee now, after the effective date of this bill, will have 80 hours of paid sick time. And there are certain qualifications on that. It needs to be available for use immediately. And if the person's subject to quarantine due to COVID-19, if they've been advised by a healthcare provider to self-quarantine due to COVID-19, if they're experiencing the symptoms of the disease and seeking a medical diagnosis, they're available. They can have paid sick leave. We'll talk more about that. I know a lot of your questions relate to symptoms and what if somebody's sick at work, so we'll talk more about that when we get to questions. If they're caring for an individual who's subject to quarantine, if they're caring for a child whose school is closed or whose childcare is unavailable due to COVID-19, and if they're experiencing a substantially similar condition, that's undefined yet, probably waiting for further guidance on that. But those are the 6 ways you can get the paid emergency sick leave. Now, those are reimbursed. That's paid by the employer, and it would be capped at $511 a day. Be paid at the ordinary rate of the employee. For a full-time employee, 80 hours. For a part-time employee, the average number of hours worked over a 2-week period. The difference here is if they're taking this paid sick leave for reasons of school closure or childcare concerns, the reimbursement rate is only 2/3, which matches the reimbursement rate under the emergency FMLA, and it's capped at $200 a day, which also matches that cap as well. So it's treated differently if the person is taking leave due to school closure than if they are experiencing symptoms or ordered to quarantine by the government or a doctor. So treated a little bit differently there. So the potentially the emergency paid sick leave provision covers that 10-day gap that someone would have under the emergency FMLA. Next slide. Thank you. Now, the tax credits are how these things would eventually be reimbursed. The upfront cost is to the employer. Employers are eligible for a refund of the amounts paid under the Social Security payroll tax. The tax credit would be coming back from the Social Security taxes, and the credit is capped under the FMLA in line with what you'd have to pay at a $10,000 max. And for emergency paid sick leave, it's capped at the 511 cap on the days someone can be out. That's the maximum amount someone can receive. So that's the maximum credit that an employer would get. There was some questions that we saw about keeping track of all of this. This would be one key reason why to keep track of which provision someone is utilizing when they're out on leave, because the reimbursement rates and the payment rates, but the reimbursement rates are different.
All right. Is that you're good for now, Chris?
I think so. I believe this is a slide from Vision One.
Yep.
I don't recognize this from us.
Yep. So we can go ahead and switch over to Michelle Bonahum of Vision One High Performance Group, and she's going to share just some information and things that they've experienced with companies that are coming up with solutions right now. So, Michelle.
Hi, this is Michelle Bonahum with Vision One High Performance Group, and I've had the privilege of being able to work with dozens of companies as they've been trying to navigate this this crisis over the last couple of weeks. And I found that there's really four camps that businesses are going into. The first is no action. So there's several businesses that are still operating business as usual, not putting a plan into place. Based on what Steve talked about earlier, we recommend not doing that because it's likely that there's going to be some changes coming where you need to be planning. But then the other three areas are a little bit more proactive. The next is more of a compliance phase with really looking at how do we, as an organization, focus on social distancing. Some of the examples of companies are putting into place some flexible hours, maybe multiple shifts and breaks, so separating the employees into groups, separate work areas themselves. One of the big things is making sure that any non-production personnel is able to be working from home and then leveraging technology such as Zoom. And I think the biggest thing right now that the governor is indicating is that make sure you're communicating the importance of this to your workforce because they're looking at how our state is complying to the recommended shelter-in-place rules or recommendations and guidelines. And so continue to communicate to your workforce. The next group of companies is really taking more proactive solutions. And, some of the things that we're seeing, we've been doing a lot of contingency planning with our clients and helping them to look 2 steps ahead. So look to the other states that have ended up shutting down or doing a shelter in place and look at how they're handling the solution. Look up your supply chain. So look to your customers and to their customers and to the OEMs and determine what is it that they're doing, because a lot of times, with some of the clients we've been working with, they were still seeing quotes coming in, they were seeing good backlogs, they weren't seeing some of the trickle effects of what was happening. So make sure that your workforce is looking a couple of steps ahead and up the supply chain. As Steve indicated, make sure that you're aligning to essential manufacturing and find ways that whatever it is that you're producing can align, get those things in order, and then start thinking about who's your essential personnel. So start looking at your list of personnel and determining what your next steps will be. The other thing that we're seeing from a proactive solution is really cross-training on mission critical. So we've got, there was one manufacturing company that took key people that were in other departments and focused them on sales and making calls to their customers to see how they could be adding value to their customers right now, which gave them some good information and reinforced that they were a value add to their customers. Another company put in a Plan B production team, so leadership, various members of leadership had a Plan B in case their production was shut down. And then others are considering the Minnesota Unemployment Shared Work Program. You do want to be careful about that because my understanding is there's some legislation and some short-term relief that's coming that may impact the forgivability if you do engage in those programs. That is something you can consider as well. The companies that are really proactive, where I've been amazed to see the greatest results, are those that are really sitting down and looking for out-of-the-box solutions. They're engaging their workforce in those out-of-box solutions. There's a lot of brain science around why you want to do that, because in times of crisis, we shut down and we go into fight or flight mode. And so if you continue to engage your workforce in coming up with out-of-the-box solutions, it actually keeps them out of that fight or flight mode, and it keeps them looking at solutions for the problem. One of the biggest out-of-the-box solutions we saw is that one manufacturer, their supply chain dried up because they were relying on some components from Asia. When Asia was shut down, they actually contacted a competitor and they worked together to leverage each other's supply chain. They were able to produce the order, and now that competitor is actually in New York and California, and so they're shut down. So they're reaching out to this company and working together. So that's a nice creative way to leverage not only your customers, your suppliers, but also even your competitors to say, how can 1 + 1 = 3 in this season? You know, look for innovative ideas from other industries, associations. MPMA has partnered with other associations to be able to give you tools and resources. One tip is, you know, assign different people throughout your organization to look at different aspects of this. So not everybody's not sitting on every call and learning all the information. It can be very overwhelming. And then, like I said, finally engage your workforce in creative solutions. One example, my team actually, one of my team members couldn't sleep one night. She called me the next morning, said I couldn't sleep. We've been a virtual office for 5 years, and so I created an online course and tools and resources to help our clients learn how to operate as a virtual office, because in manufacturing that's not common. And so, great example of how we engaged our workforce in coming up with solutions, and she was very excited and motivated by that. And so, just encourage you to take the time to think outside the box during this time. And you'll see that there's some really great workforce solutions that will come out of it.
All right, thanks, Michelle. This is Steve Kalina again. I want to touch on just a couple of examples of things that I've heard about in the last few days that kind of touch on some of the points that Michelle spoke on. But I think, you know, the number one key, I think, is to kind of connect with the industry as much as possible. As Michelle even said, you know, potentially with competitors. There's 3 companies I talked to this weekend on the East Metro, 3 manufacturers that actually created kind of a mini consortium where they kind of pledged to partner with each other and figure out how they can help each other with labor, equipment, capacity, so that as one of them may get hit with labor shortages or an influx of work on crucial programs, they'll be able to support each other. Stratasys has partnered with Dunwoody on Stratasys is printing some Lexan headbands for masks, and then Dunwoody is actually doing the finishing machining on them. I talked to one manufacturer this weekend who's looking to get a program on ventilators. Their customer is scrambling to try and get some production going on that, but they realize that their steel supplier is shut down right now, and so trying to figure out the supply chain on that. So I think the key message here is that all of us can play a part in that critical supply chain. So whether you're producing medical devices or food-related items or defense-related items at this moment, there's ways to be able to support each other. And I think we're going to see challenges where each manufacturer is faced with shortages or challenges in keeping people employed. And so I think being able to kind of share resources back and forth and communicate. So again, as Michelle mentioned, there's a lot of tools that are in place or being created to accomplish that. So I encourage you to look outside the box and just look for companies that you can connect with and resources you can take advantage of. So I want to open it up to questions here. I know quite a few people actually submitted questions prior to the webinar. So if you do have questions, please feel free to put them in the chat log right now. And then the team at Eckberg Lammers is going to be kind of fielding the questions and answering them as best they can. So Tom, I think you've got a few of the pre-requested questions. I don't know if you want to start with those. And then
yeah, I've actually, well, because I got my screen sharing here, I'm locked up. So I think Kevin's got a collection of the questions here, and we can run through some of those pre-ones, and then if we have time, we'll jump into the ones coming in through the chat. Certainly, if anybody has any questions, please continue to submit those on chat, and if we run out of time, we'll try and follow up with you on those pieces and work with Steve to make sure we get that out to everybody. But I think Kevin's got the pre-questions up, and so we can run through some of those quickly.
Sure, I do. Can everyone hear me?
Yep.
So one question submitted by a company was, a doctor says an employee is compromised and should not work. We put them out on FMLA leave if they qualify, or a medical leave. Is it not a layoff? How do we deal with those employees? And Chris, do you want to answer these questions? I think you had put together some preliminary thoughts on these.
Sure, Kevin. Thank you. I think one of the questions here would be, what do we mean by compromise? But to the extent that they've been exposed or showing symptoms, considering medical treatment, things like this would appear to qualify under emergency paid sick leave. So that would probably be the first place to look for that. Wouldn't necessarily qualify under the FMLA, but it appears to qualify under the paid sick leave provision. So that would probably be the first place to look.
I think one of the important things to note here is, the federal legislation that has gone into place. There's the two pieces to it with the emergency sick leave and then the FMLA. And the emergency sick leave is for those confirmed cases of COVID-19 or substantially certain cases of COVID-19, and it's intended to go into effect immediately. So obviously the goal here is to not have this virus continue to spread. And the reason that this legislation is in place is to get those employees at home, but then also ensure that they're still receiving their income. And so that's why the emergency sick leave is immediate. It's full income for those 2 weeks if these COVID cases arrive. And so you got to monitor that within your company. And if someone comes to you and says, I've got a positive test here, get them home, be sure that you're paying them under this legislation, and then you're going to get that tax credit on the back end that's going to compensate you for that payment.
Next question. Similar employee, but this employee must take time off to care for children who do not have school or daycare available. What type of leave do they go on, and what sort of benefits are they entitled to?
This employee would really be entitled to 3 different types of leave under these new provisions. The first is they'd be qualified for the emergency paid sick leave, but they would be qualified for that capped provision where 2/3 of their wages would be paid up to $200 per day. Additionally, they can take the first 2 weeks unpaid and qualify for the emergency FMLA, at which point their reimbursement rate would be the same, capped at $200 a day for that remaining 10 weeks. Additionally, if they wanted to take that emergency FMLA and utilize any PTO or sick time they have with whatever your company's policies are, they would be entitled to do that under the emergency FMLA provision as well.
Next question from this same company. The April 2nd effective date of this new law with mandated sick time, what should we know about tracking who uses it in case there's some type of financial credit from the state or federal government after the fact? And Chris, I think you answered some of this already, but in fact, there are some tax credits that come along with these new laws. And so definitely employers who have employees going out on leave need to be closely tracking and keeping record of who's gone and documenting why they're gone under these particular laws so that you can get those tax credits. Is that fair?
Absolutely. And because the reimbursement rates are different, you want to ensure the maximum reimbursement. It's really important to know who's out on that paid sick leave in particular. You need to keep track of both, but the paid sick leave with a higher reimbursement rate, you're going to want that the full amount of your Social Security tax credit.
Quickly, I see a question came in here in chat, and I think this question is for you, Michelle. It says, we were hoping for the implementation of the shared work program. However, I just heard of the need to watch for legislation coming out that shared work may not benefit us. What could be a negative of the shared work program, and what legislation should we be watching out for? Do you have any insight on that, Michelle, or any legislation that may be coming down?
Yeah, so there's not specifics. I know that the state of Minnesota is working on alongside of a program to help out business owners that might be quicker than the federal SBA relief program. And, they're still working out the details of it. And my understanding is that it may be partially forgivable, but it might impact some of these other programs. And so just make sure that before you apply for any of these programs, you're looking into all of the options. Unfortunately, we don't have any more information than that.
And looking at other questions that have come in, Question from Corrine here, how to handle employees who say that they have symptoms, but there are not tests available in most places for the public. It is hard to get confirmation, and the CDC recommends not requiring any documentation. Yeah, and that's, I think, an issue that everyone's kind of grappling with right now. What about the employee who may be trying to take advantage of this leave policy and saying they have symptoms, but there's a lack of adequate testing available to actually confirm that they have this coronavirus illness. And as Corrine has pointed out, I think the CDC recommends just err on the side of caution and let those people utilize leave on behalf of work, and it's better safe than sorry. And whether that's legally required, I don't know that it's legally required, but the wisdom is, I guess, that again, better safe than sorry, and let people use the leave. And that's maybe going to be burdensome to some employers, but the burden of having your entire workforce go ill because you keep someone on the workforce that ends up actually being sick is a greater cost to you. And so you're better off letting those people be out, even if they don't have a doctor confirmed case. I think the CDC is saying, typically under FMLA leave, employers have every right to demand a doctor's note, so to speak, or doctor confirmation of the need for FMLA leave. But under this emergency provision, and due to the challenges that the medical field is facing, it seems like the guidance is people aren't going to be able to get that sort of doctor confirmation in many cases, and so err on the side of caution and let them be out on leave. Any thoughts on that?
Kevin, to springboard off that quick, we had a question come in from Kristen that said, how are companies handling or supposed to handle employees who claim a work-related exposure to COVID-19? What type of considerations should those companies be making?
Well, and yeah, I looked at that a little bit from a workers' compensation perspective. If someone actually, so if one employee has a confirmed case of the illness and then other employees subsequently get it, I think that's a potential for a workers' compensation claim by those other employees to the extent they are exposed to that illness at the workplace. And there is some case law in Minnesota, dating way back to the 1980s, where a person, ironically traveling to Asia on a business trip gets exposed to a flu virus over in Asia while on that work trip. And the law in that case said that person had a legitimate workers' compensation claim for being exposed to that virus and that illness while working. And so I think that same sort of law likely would apply here in these scenarios in these times. If an employee can demonstrate they caught the COVID illness from another co-employee that while at work, then that's a potential for a workers' compensation issue. And I think that's yet another reason to direct those employees who are having symptoms out of your workforce sooner rather than later. Another question that just came in, when do we allow them to come back to work? No testing available. And again, we're lawyers, not doctors, and that's a tough thing to answer. It seems like the medical wisdom these days is people need to be symptom-free before they're really considered to be safe to be interacting with others who are not sick. And I don't know what others have found in terms of wisdom on when is it safe to let someone come back to work in these sort of scenarios where there's not enough tests available to confirm that they're over their illness. Thoughts on that, Tom or Chris or others?
I just see that Kristen said that the current recommendation is 2 weeks and then 72 hours symptom-free. So, obviously this is a very fluid situation. Information is ever changing. So, I mean, if that's the recommendation right now, that's obviously the FML or the new legislation is intended to ensure that people can be out of the office for 2 weeks without a detrimental impact to their livelihood. And so the 2 week seems like a number that you hear a lot, the 14-day quarantine. And so then Kristen's saying then you want to see 72 days of symptom free, which may be the case. I'm not sure.
Yeah, 72 hours, I think you meant to say.
So Dale had said if an employee is high risk due to underlying health conditions and wants to stay home, do they qualify for the emergency paid sick leave? Under the current legislation, I believe the answer to that is no. Just because you're a high risk doesn't qualify you for compensation from your employer under this legislation. You know, there's another conversation we had whether or not they should be stay home and how you want to treat that as an employer, but they're not entitled to the protections that are provided by this legislation. Chris, I don't know if you have an additional thoughts on that, but my understanding is just because you're high risk, you don't qualify under either the emergency sick leave or the FMLA at this time.
I would agree. We'd have to look to whether or not there's been a healthcare provider advised quarantine for this individual, but if not, I would agree that you're outside of the qualifications.
Sure. Let's just do a couple more quick ones here. We had a question that says if an employer has already exhausted 12 weeks of their regular traditional FMLA, are they entitled to an additional 12 weeks under the new emergency FMLA? Chris, do you have an opinion on that?
I do. I think it's supplementary. These are in addition to the FMLA benefits. This is a specific public health. It's termed public health emergency leave. It's supplementary. So they're although it's under the Family and Medical Leave Act, and it's an amendment to it that's supplementary to it. So you can expect that this individual would be eligible.
Sure. Another question that we've seen from a few different people is, you know, in anticipation of this, companies have been proactive. And as Corinne says, they've already extended 80 hours of additional sick time for any COVID-related absence. So the question is, would that be included, the required additional 80 hours through the legislation? And if so, can they revoke the previous policy? I think the recommendation on this is to maybe not revoke, but amend the previous policy to note that your policy is now intended to comply with the federal legislation. And so in consideration of the federal legislation, you are granting to all employees who have to leave for COVID-related symptoms the sick time, the 80-hour sick time. And that will not create an uproar to say, well, you guys are revoking this policy that you put in place, but it will clarify that this policy is now in lockstep with the federal legislation, and therefore they only would have the 80 hours. You wouldn't be giving them 160 hours of emergency sick time or sick time related to COVID. Is probably the best way to handle that. Chris or Kevin, I don't know if you have opinions on that otherwise.
I agree, Tom. I think ensuring compliance is important, and then it also it says, the law says that an employer shall provide an employee this time. So by doing that, by acting early, you've probably met your requirements under the federal law. But one of the aspects of the federal law is this is not sick time that can carry over from year to year. So making sure that policy aligns with that would provide you the best protections.
Yeah. I think we're kind of getting to the time here. I guess, Steve, I would let you chime in. I don't know if there's one or two more questions that are particularly pressing that you've been hearing about from MPMA members that we could assist to answer while we got everybody on the line here.
You know, I think so many of the questions that people have are kind of anecdotal on specific scenarios. So I think that they're all valid and they're all urgent. And I think it's hard to try and narrow it down. But I think you know, at this point, I know we're past the time. We wanted to keep it a short and sweet presentation here. What I would recommend is that we, coming out of this session, we'll have a copy of the chat log. And so we'll have a copy of all the questions that have been asked that haven't been answered and the people that have asked those questions. So we'll make note of that, and we'll try our best to answer as many of those questions as we can offline. And if there's some of those that are key questions that apply to most companies, that we can also put those on MPMA's resource page for COVID-19 as well. So I think we probably can wrap it up now, and I apologize we couldn't get to all the questions. I'm sure it's everyone's got a lot of them right now, but so I don't know if
one quick note here. This question from Robert is quick. He says, can we require employees to use PTO during the emergency 80-hour sick time? You cannot require it. Employees are allowed to use it, but it can't be an employer requirement. And so make sure you don't do that. The other thing I will note, as Chris said at the beginning, this legislation is very, very fresh. It was enacted last Thursday. It's not even a week old. We are waiting. By the end of the day tomorrow, the Department of Labor is to have issued some guidance and additional rules telling us how this is going to be implemented. And so hopefully once we get that guidance and those rules, we'll have a deeper understanding of how this is going to go into effect. But I mean, as of right now, every employer is going to be required to comply with this with their employees starting on April 2nd. And so it's something that every employer, no matter how small, needs to be aware of and keep on their minds as this thing progresses, and keep an eye on, so that you're making sure that you're not running into trouble when an employee has a COVID-related issue.
And Steve, maybe we can just watch for that agency guidance that's coming out, and perhaps you can put a link to it on the MPMA website so that people can watch for that and download it and read it for themselves once it is issued.
Yeah, absolutely. All right. Well, I know we could have probably gone for a couple more hours, and apologize we can't answer all the questions at this moment. So we'll try and get back to you with any questions that haven't been answered. I really appreciate Chris, Tom, and Kevin from Eckboard Lammers joining us today, and Michelle Bonahum from Vision One High Performance Group. Thank you all for taking the time out of your day to join us. I wish you all the best. Feel free to reach out to me personally, steve@mpma.com. I'm doing everything I can to try and field questions and point people in the right direction, so I'm happy to help. Wish you all the best. Good luck with everything, and look forward to talking to you again soon. Take care.